You're listening to the Public Health Perspectives podcast. Welcome to another episode of Public Health Perspectives, a podcast series targeted towards strengthening the future public health workforce. We will explore the narratives of public health care professionals and gain insight on career paths that shape the profession. And now, your host, Camilla Singletary.
Hi, welcome to another episode of Public Health Perspectives. Today we have Dr. Allison Chamberlain on the show.
Allison contributed to a case study in JPHMP's 21 public health case studies on policy and administration. Her work surrounded the 2015 Legionnaires outbreak in New York City. Welcome, Allison.
Thank you. Glad to be here.
And just to start, for those that don't know much about the disease, can you give a very brief description of what Legionnaires Disease is?
Sure. Legionnaires Disease is a type of pneumonia that's caused by a bacteria, Pneumophylla mainly, and it is found in sort of warm, stagnant freshwater sources, so it can proliferate and thrive in certain types of plumbing situations, and it becomes a problem when it is aerosolized and people breathe it in. So that's how it can get into people's lungs. And it's most concerning for folks over the age of 50 or anyone who has an immunocompromised immune system and others who might have some underlying respiratory health issues. But it can be very problematic and cause a really dangerous type of pneumonia that can lead to death even in some cases.
And so what was your primary role on the project?
Sure. So I, as you probably know, I work at Emory University, which is in Atlanta, so we're not really that close to New York City, but we have done some research here in the Center for Public Health Preparedness and Research on Legionnaires Disease over the past 10 or so years. And Dr. Novick had approached me to see if I would be interested in potentially writing a case study on the New York City outbreak, and we had agreed that that would be a good topic to focus on, and so I ended up leading our team's efforts to go up to the New York City Department of Health and Mental Hygiene and conduct interviews with some of the public health department staff who were intimately involved in that outbreak response and learn from their perspective what it entailed to investigate that particular outbreak and the public health department's response during that time. So it involved involved travel to New York and talking with those folks. And writing up in a case study format the events of that particular outbreak.
And so I guess this kind of segues into it. I know there was SAT scan initially, which kind of, took a look at diseases that were in a particular place at a particular time, those clusters of diseases. And then later the incident command system was used. And so it sounds like you were more of part of the incident command system, because I know they form partnerships with a lot of different sectors in public health, especially to get the information out to the community about the disease and, some of the preventive steps they could take to avoid it.
So I actually was not involved in the outbreak response or the incident command system at all. I was sort of a complete external reviewer of this whole enterprise. So I came in about, a year after maybe they had the outbreak to do these interviews. So it had already passed, and I was coming into the health department to ask questions about how the response went for the purpose of developing the case study. And so for those of you that may not be familiar, SAT scan is an epidemiologic surveillance tool that health departments across the country can use. And at the time, the New York City Department of Health and Mental Hygiene had adopted that particular surveillance system and tailored it for their purposes to help them identify might be concerning clusters of various infectious diseases, of which Legionnaires Disease is one, that they tailored their program to sort of watch for in their communities. And so they did use the SAT scan tool to help them identify, and in this case, identifying what ended up being this outbreak. But insofar as what, ICS is, it's an incident command structure or system that's a standardized approach to organizing and coordinating an emergency response in a way that really provides a common hierarchy in which responders from a variety of backgrounds or departments can be effective. So public health departments across the United States use the incident command system structure to organize their employees and mobilize around a response. And activating an ICS is really no small task. It means the staff have to greatly limit their normal responsibilities in order to work on the emergency at hand, to fulfill their role in the response effort. So in general, you want to activate as early as you can with an incident response. It really is an all hands on deck activity. So the downside to activating an ICS is that you forego or dramatically reduce other important health department activities that might also need to go on during that emergency situation.
I kind of mentioned before about forming those partnerships, and they talk about kind of proactively reaching out to people that they had great relationships with, being part of the workforce and, knowing about some of the job duties that are entailed in responding to things such as infectious disease outbreaks. What kinds of things do you expect in the future? So I know the ICS, like you said, is very entailed. And I know some of the smaller health departments and things like that probably don't have the ability or enough staff to kind of delegate those duties to separate people. So as far as the future is concerned, what do you think some of the expectations may be as far as forming groups like this to respond?
Well, yeah, so good question. So the ICS structure can operate at many levels, and that's sort of an important thing to sort of take note here is that for any size health department, if there is an emergency within their jurisdictions, the health department itself will have its own ICS structure to organize its own folks, but there will be representatives from within the health department that will serve on maybe a larger ICS for the entire jurisdiction, where the health department might be one representative on a larger incident command structure or emergency operations center, for instance, where there are representatives from the police force or the fire department or emergency management, for instance. And I think it already is invaluable and be increasingly, important for health department employees and staff to have relationships ahead of time with those other partner entities within their jurisdiction so that they each know each other prior to an emergency and can, work with each other effectively if an emergency does come up. So that is sort of like, if you want to talk about ICS, do we want to sort of focus on what's happening inside the walls of the health department or their role in participating in a larger ICS structure that the whole jurisdiction might be involved in? But even for a locally, organized event or emergency or a training or something like that, where the public health department might be, implementing its own ICS, regardless of whether something larger is stood up in the jurisdiction, if it's needed or not, it still is important for, health department personnel to have relationships outside of the health department that they can tap for expertise or contacts during an emergency or transportation issues during an emergency, things like that. And I think those might be the types of things that you're talking about. But a lot of that really entails being proactive on the part of the health department to maintain those relationships. There might be a lot of turnover that happens at other organizations or even within the health department, but maintaining sort of an up-to-date Rolodex of people that you can rely on and contact during an emergency is really invaluable for spreading the capacity of the health department to help its residents during an emergency.
And I definitely agree that you have to work outside of what you're comfortable with. So, health departments need to be comfortable, like you said, outside of the walls of their departments. And my thing is, why wouldn't you want to work with the team? So you have so many different heads with so many different ideas and probably solutions to the problems, especially when it comes to responding to something that's affecting such a large portion of the population. And so I understand that you work now as an academic consultant for the Fulton County Board of Health. Can you tell me a little bit about your role with them?
Yes, that's right. I'm an epidemiologic consultant with the Fulton County Board of Health, and I've been in that role for about a year now. It'll be a year in just a couple days, actually. It sort of arose out of two sets of circumstances, really. One of my own doing and one of the health department side. I guess about a year and a half ago, I was really searching for ways to make my faculty position sort of more applied. I wanted to do something where I felt my research and epidemiologic skills were being more directly utilized to improve public health. And I had also never worked in a state or local public health department before. I already knew that sort of was a gap in my resume, so to speak, and I really wanted to get that experience. And so after meeting with and brainstorming with a number of colleagues, I ended up in my dean's office, Dean Jim Curran, who is the dean here at the Rollins School of Public Health, and he had just been speaking with Dr. Kathleen Toomey, who is the director of the Fulton County Board of Health. She, at the time, was actually seeking a faculty-level consultant to come work at the health department. So So Dean Curran arranged a meeting, and sort of long story short, things worked out, and I've been down there at the health department for about a year now. But you know what? In terms of my role at Fulton, being informed by the kind of the case study that I did in New York City, I've been thinking about that a lot recently, especially since you kind of reached out to me about this podcast, and I think it definitely had an impact. I think being able to go to the Department of Health and Mental Hygiene headquarters, interview many of their staff, and really learn the complexities of outbreak investigation and emergency response, it just exposed me really for the first time to life inside a local health department. And granted, DOHMH in New York City is no ordinary local health department, but it still impressed upon me the kind of exciting impact public health professionals can have at a local level.
And it really speaks to that case-based learning, which is exactly, what the book is trying to do. You went out there and you lived those experiences. You got to talk to the major players who were a part of the response. And I'm sure, and for you too, it made things seem less abstract. Like you had probably read tons of information about the disease, but actually being there, that hands-on experience, like that is so important. And especially in public health, because sometimes people do, stay inside those boxes and you don't even realize what's going on with different groups in your own community sometimes.
Right, and you don't realize how your box relates to other people's boxes.
Right.
And how what you want to get done impacts what other people want to get done. And so it really shows you how and why you need to work effectively with people in, quote, those other boxes, whether that's in environmental health or that's, another division entirely like the, Department of Buildings or whatever, or the, water systems, folks doing, water sanitation type stuff. Like you really realize what public health's role is in the bigger picture. And so that, I think, really opened my eyes when I went to New York City. And I thought, I would like to get more exposure to this. And so that's kind of why I sought out this opportunity with Fulton County.
So your home institution is Emory University. How has Emory benefited from you working on these projects and definitely working for the Fulton County Board of Health?
That's a great question. So far, for Emory faculty, other faculty at least, I think the greatest benefit is having a colleague that's embedded within a health department in town. And a health department down the street. That means that to date I've facilitated a number of different grant proposals, connected my Emory colleagues with Fulton County staff that are knowledgeable in subjects they're interested in, and submitted a couple of conference abstracts related to the work that I do down at Fulton. But this has really been a bi-directional benefit. I've also connected my new health department colleagues with experts at the Rollins School of Public Health when they've needed or wanted assistance, especially in an area that goes beyond, my scope of knowledge or expertise. But what I sort of like the most is my ability to integrate students into my work down at the health department. Last year I had 3 MPH students working on projects with me, one of which became an MPH thesis for one of the women. This year I currently have 2 MPH students and 1 PhD student working with me. And being able to connect students with projects that are not only interesting to them and sort of check off boxes for their academic learning, it exposes them again to the health department atmosphere and what types of things the health department is, grappling with. But it also sort of is of relevance to the health department and getting, tying together what the students need to have done with a programmatic question that the health department wants answered. I think it's getting the students involved that is probably the greatest benefit to the school.
That was one of the things that I really wish I had done. Graduating with my bachelor's, and then I got my MPH. And especially with the bachelor's, people are like, oh, are you going to work for the health department? And of course, at the time, I had no idea what I would do, but I didn't even know, and I still don't quite know the structures of a lot of the health departments, even the ones that are here locally. And the thing about public health too, especially talking about community work, there are so many different roles that are considered public health, but not necessarily identified professionally,
Right.
And so what are some of the projects that you've been working on at the Board of Health in Fulton County?
Last year, I guided a student through a project with Fulton's Emergency Preparedness Division aimed at revamping their points of dispensing or pod plan. And that's a plan that guides where and how the health department will stand up places to distribute countermeasures like antibiotics after a public health emergency. That project helped the county a lot, and then my student got her thesis out of it. This year, I'm helping with two studies involving secondary data analysis, one that's exploring risk factors for recurrent syphilis among Fulton County residents, and one looking at risk factors for HIV seroconversion among women seeking care at the Fulton County Board of Health. I'm also helping the county implement a survey at two major gay pride events in the fall, the Black Pride Weekend and the Atlanta Pride Festival. So lots of sort of interesting stuff happening with students kind of peppered throughout, working on different aspects of these studies, helping either with, getting a practice amount of data cleaning, or doing the actual analysis for their thesis, as well as volunteer opportunities for, recruiting participants at these events upcoming this fall where we want to do the survey. So it's nice to be able to sort of get them exposed to all different types of, planning, primary data collection, secondary data analysis and cleaning, and things like that. It just gives them a lot more context to the stuff they're learning in the classroom.
Cool. I like that you guys are using Pride as a point for gaining more information about HIV and AIDS and some of the behaviors there in Atlanta, because I believe Atlanta has some of the highest rates in the country, right, of HIV and AIDS.
Fourth highest prevalence in the country, I believe, right now. And so that's one of the things that this particular opportunity in the Fulton County Health Department kind of expanded my own area of exposure in public health, because coming into this position, I had not done any research with HIV or AIDS or anything like that, or pre-exposure prophylaxis, and none of that. That whole field was, even though I do infectious disease epidemiology, I was focusing on different bugs. And so it's really opened my eyes to that, and because of that, Fulton County, that's where their priorities lie in HIV and STD prevention. So by virtue of that being their priority, that's where I wanted to, affect the most change and be the most helpful for them. So it's kind of opened up a new avenue of research ideas and, skill set opportunity that I, even as a faculty member in a school of public health, I had not gotten before. So it's kind of, through this process, I'm also still learning a lot and hoping to be an effective presence on this particular epidemic that's really concerning to Atlanta in particular.
And so I started out, when I was in undergrad, working for our health center there, and I focused on HIV and AIDS. And I know, especially in my courses too, there was some difficulty kind of defining. So for example, like MSM, men who have sex with men, because they don't necessarily identify as bisexual or gay. And, the same thing for women, sexuality is on a spectrum. So what do you guys do to kind of capture more of that information from those who don't necessarily define themselves or categorize themselves, as gay, lesbian, bisexual, and things of that sort?
That's a great, you're very knowledgeable about that. And we do address those questions with actually directly asking questions about, what are their sexual behaviors? And that's kind of, and on the post-coding side is where we might, put them into categories of, what types of sex they have and identifying that way. Because we know that whatever the label is doesn't really matter as much as, what the risk behavior is and the risk behaviors that are associated, or the sexual behaviors that are associated with higher risk. So we really try to ask our questions focusing around sexual behaviors. Even though those are very sensitive questions, that's really how you want to try to start identifying the people that are at greatest risk. So our questions do go into some of those more personal aspects of someone's, sexual life, but that's really what's the most important to us as public health, practitioners and preventionists.
Right. And I think removing the stigma, especially surrounding the labels and, sexuality is a good step in the right direction. And so with your position and, talking about what it means to succeed as a individual in public health, what are some of your ideas of success in regards to the work that you've done?
I think my idea of success is to see that both sides of this arrangement, the Fulton County Board of Health and Emory University, benefit meaningfully from their investment in this role that I have. And what, quote, benefit meaningfully looks like, I have my own concrete benchmarks like academic papers, target numbers of students that I engage, and grant applications that might leverage the connections that I've helped in some way to build. But, the projects I directly assist with, if they can improve public health in Atlanta, and if this sort of cow path that I've forged between my academic institution and this local health department can at least turn into a paved 2-lane road that might, persist for longer than maybe I'm even in this position, that is what I would consider a major success. So
if I can, really establish the relationships and get the Fulton County, Board of Health staff to be talking routinely to the Emory University, Rollins School of Public Health faculty, and, knowing that they can come to us for quality students to help on projects, and that can sort of be sustained over time, I think that would be a huge success. And there are other, I'm trying to take lessons from other jurisdictions across the country that are establishing these, academic public health partnerships. There's other wonderful, Knox County, Tennessee is a great example. Seattle County is like the premier example of this. But taking lessons from what they've done to ensure that this is successful over time is something that I'm very mindful of and want to not reinvent the wheel where others have been very successful in doing similar types of things.
Right, and you're in a great position and a really unique position with JPHMP. We run a blog site, JPHMP Direct, which is where the podcast will be. And so in trying to target more students, our thing is how can we bridge research and practice? For so long, academia has been separated from the practice components of it. Sometimes it's hard to connect what people know academically with actual practice because those who are practicing are not always up to par on some of the jargon and the literature and the data surrounding the conditions that they are working with, but they know the people they're working with, they know the activities that are associated with certain disease outcomes.
Yeah, and I think that, to be able to be in this role, I'm entering my second year now, to have, at least 2 years in this position, to have that longevity that I feel like is necessary to start sort of some type of institutional memory on both sides, on both the health department side and the Emory side, to be able to sort of more strategically and thoughtfully place students in roles where I said, okay, here's where we started with the syphilis project, here's maybe our preliminary analyses show, here's where I think you can be helpful in helping us get to this next point, and we can sort of start making more impactful outcomes by virtue of kind of knowing where things started and knowing where we want them to go. And I think that's what's lost a lot of time when students get, plugged into various practica at health departments is they're there for 2 months, 3 months, and then they get pulled out, and then there's no one there to sort of high up the what they did and tie it into what needs to be done next. And I feel like that's where I, think my value is being able to be that constant conduit to be able to remember what's gone on and to show people the ropes and where the health department might want to go in the future. But yeah, I agree. I think that a lot of people get their degrees in their, in School of Public Health, and, some might go work in a health department. And after they get in the health department, they do get so busy with what they need to do down there that they might not touch another academic, faculty for another 10 years before they go to a conference or something like
right.
that. So I think that that's where, where we do have this sort of unfortunate void happening is that we do a great job of training these students and while they're here, but then they do lose touch, I think, with academia, and that shouldn't happen. I feel like there's a lot of mutual benefit to both sides to maintain those relationships more strongly.
Definitely. And since you do work closely with students, what's some advice you might give future public health or students who are in public health or students who are going to become future public health workers? If you had to give them one piece of advice or one tip that you wish you would have had, what would you say?
Design a survey. That is the hardest thing to do. You think it's so easy to design a survey, but it is the most useful skill to be able to think through how you want to ask questions, how they're laid on a piece of paper. What is the readability of those questions for your target population? Are you going to get the data that you think you're getting the way you're asking a question? Have you reviewed your survey with a whole bunch of other people to get them to pick it apart? I think that is such a useful skill, and it gives you and then if you're going to implement it, you get experience doing first-hand data collection, which I think is invaluable. I think along those same lines, encouraging students to do their own data collection at some point during their degree, experience. I just don't think there's any better way to learn than doing that yourself. Whether you're recruiting patients, whether you're out in a festival trying to recruit participants, whether you are interviewing someone during maybe it's a qualitative focus group type scenario. I think all of those experiences are 100 times more valuable than doing secondary data analysis. I just think that you just learn more about the quality of the data and how data is actually produced when you do it yourself. There's subtleties to how you might approach someone to request their participation, and honing those, I think, are useful even beyond the data collection experiences you might have. I think all of those types of things are sort of some of the soft skills that I feel like maybe aren't as explicitly taught to students in public health programs as they should be. So getting those experiences, I think, are just like I said, invaluable for whatever you go on to do after your MPH or your PhD.
Most definitely. Thank you so much, Allison, for joining the show. This has been a great conversation.
All right, thanks a lot. See you later.
Bye. This concludes another episode of Public Health Perspectives. I'd like to give a huge thank you to Allison Chamberlain for joining the show, as well as the Fulton County Board of Health and the Rollins School of Public Health at Emory University in Atlanta, Georgia. I invite you to explore some of the other resources that we have available on JPHMP Direct, including a brand new series of case studies geared at public health students and others interested in epidemiology. The series is called Backstories in Epidemiology, True Medical Mysteries, and is edited by the Editor-in-Chief of the Journal of Public Health Management and Practice, Dr. Lloyd Novick, along with his wife Carol Novick and Dr. John Marr, an eminent epidemiologist who served as director of the New York City Bureau of Communicable Diseases during the 1970s. Each month, a new true medical mystery will be published in its entirety on JPHMP Direct. Available now is The World's Deadliest Poison, written by Drs. John Marr and Marcus Horowitz. You'll also find an interview with Dr. Marr on the site where he explains some of the inspiration for the new series and briefly relates the story behind The World's Deadliest Poison. This concludes another episode of Public Health Perspectives. Thanks everyone for listening, and if you haven't already, please consider subscribing to JPHMP Direct so that you never miss any future episodes of the show.